Dr. Adira Care this side. Welcome back to Bite Sized Industry. Hope you guys are all doing well. Here you guys hear stories instead of boring studies. If you wanna hear stories and don't get bored up or messed up due to your curriculum or academic subjects, you can follow my channel. So before starting the topic, I need to say something like about I know anatomy is a very volatile subject and a very boring subject for the first year BDS as well as the NEET MDS aspirants, because it was a first year subject. We tend to forget everything. So for those who find it difficult and all, like I was in your place that I was like, I don't know how to study anatomy seriously. That time my friends used to say, yeah, anatomy is very very good subject, you need to learn like that. I never was like, I don't know how to learn, but later onwards I myself got made many stories, many mnemonics that was very useful and guided me pretty much. So yeah, I'm not making you guys bored, especially for the BDS first year students. Anatomy is very easy actually. I'm telling from my experience. I have been there in your situation, but I'll make you guys learn little by little. Okay, so yeah, today's topic is foramens of the skull. And I know when you give the skull anatomy lab, if you don't know where is foramen rotundum, ma'am will be telling this is mandible, this is foramen rotundum, foramen spinosum, mental foramen, I don't know whatever foramens are there. So like you'll be thinking, what all foramens are there? I don't know where to tilt the skull, whether this is what is this and all, this view, that view. I know. Let's skip on to that. So here, as you guys can see here, I'll just move on. I consider the skull, which is our skull, the great skull, as the skull castle. I made a skull castle, and there are many foramens, many gates are there here and there, beside, behind, where many nobles exits through that. When princess, the king exits through them and is guarded by the guards. So the nerves, the arteries, the nerves which exits through them, that is the nobles which exits through them, this is the princess that is exiting through them. So before I move on to this story, it's a very interesting story to listen, where you will learn all the foramen at one go. But before that, I need to make you guys clear of some views. What is Norma Basalis? What is Norma Verticalis? What is nervous base of the skull? What is the inferior aspect of the skull? How does they look like? How to differentiate between them? Because most of the students, even including me, doesn't know the difference between Norma Basalis and the inferior of the skull, because I was a little bit confused. No one was there to tell and give me. It is a basic thing. Yeah, when we move on to the first BDS without knowing anything, this would be a greater question in your mind. So let's move on to that. I will show you a 3D model. Okay, see, as you guys can see here, this is a 3D model of the skull. This is when you move the skull. See, this is the front portion, and when you move the skull like this portion is Norma Verticalis, vertical view. Okay, from top we are looking. Then we tilt. This is the upright portion of the skull. This is the basalis. Even if we can remove the mandible, then you can see the basal part of the skull. You can see the foramens clearly here, this green and all, this green and these things and all you can see, as we can see here. Okay, so and then if we remove, we need to know what it is, inferior aspect of the skull, where you can see more foramen. Okay, compared to the basalis, parietal bones are removed, the side bones are removed, and the inferior aspect of the skull is being examined. So here you can see the maxillary midfacial part, the middle cranial fossa, which is more visible now. The sphenoid bones, the more aspects it can be seen right now. So yeah, I will teach you guys what all foramens are there. So now we can differentiate, right? When we tilt the skull, this is the basalis and this is the inferior part of the skull, and this is the frontal view, right? So this is the inferior part of the skull, where you will learn all the foramens right now. So first I could say, guys, this is very important topic. whether if you learn for first year, it will be very useful for you in the NEET MDS as well. So this topic, learn it like the back of your hand, know it like that. Okay, so yeah, so you need to know 5 foramens mainly. You need to by heart, not by heart means always be thorough. That is the foramen rotundum, foramen spinosum, foramen ovale, foramen magnum, and foramen lacerum. So these are the 5 foramens that you need to know. So let's move to the story. The skull castle. Okay, the skull castle have many gates. The gates are the foramens. The gates are the foramens in our skull. So there are many gates and they are guarded by the guards. Okay, and the prince is always, all the princes are, prince means not a princess, always they are, tend to hide and sneak and all and get out of the palace and all. So each of them manages somehow to get off the gate. Okay, and also the king also exits through the gate. Okay, without notice as well. Prince always try to, the small prince always try to sneak out. So the first foramen that we are gonna learn is foramen rotundum. As you guys can see, the foramen rotundum, from the word rotundum, rotund, a round, rotund, rotate, a round canal. Okay, the young prince always try to escape through the secret round canal. Okay, and this gate, this gate will lead to an entire territory where he can rule by himself. He is so eager that, no, before Papa, I want to rule. I can rule a territory. I want a territory to myself. So he want to rule the middle face, the mid face, that is the maxillary part, the maxilla part. So yeah. So he is the maxillary division, that is the V2 division of the trigeminal nerve. So trigeminal nerve, this consider him as the his father. Okay, his father he has 3 sons, V1, V2 and V3, ophthalmic, maxillary and mandibular. Okay, ophthalmic, maxillary and mandibular. In that maxillary is so mischievous, he want a place to rule by himself. So he is the maxillary division of the trigeminal nerve, which does want to rule over the midface. So second prince, usually the rotund, he passes through the round tunnel to rule the midface territory. Now you move on to the image. Okay, where is rotundum seen? See, the rotundum is seen here. This is the rotundum. In this thing as well, I will show you. See, this is the rotundum, this pink color, no? This is the rotundum. Okay, this is the rotundum. Okay, now we will move on to the next topic, that is the foramen spinosum. Next foramen. This is a very dangerous gate. It is a very, very dangerous gate. Red icon. It's a dangerous one. Why? Because there is blood in there, always blood, always the fight is happening there, the youth sabhi, sabko bhaga dete wahan se. Because always people are murdered there, always the enemies are murdered there, and the wall is full of blood. Okay, spine, many spines are there on the walls as well, the spinosum, the blood is spinned over there. So it is the middle meningeal artery. Spinosum spins blood to the dura. Dura means the brain. Okay, which is the middle meningeal artery. Artery is always concerned with the blood. So middle meningeal artery. See, middle meningeal artery you will learn in this one as well. The brain, blood supply of the brain. That is, even you will learn in surgery and many aspects as well. Because when a traumatic patient is brought onto the OP, and always, most of the time, hemorrhages happen due to the it affects the middle meningeal artery, and traumatic cases mainly, many medical things you can learn. You will learn it later. Surgery, many medical cases you will learn. Middle meningeal artery, just remember it like that. Foramen spinosum. Okay, now the next one, We can, okay, I will show you the image. Where is the foramen spinosum located? Here is the foramen spinosum located. Very dangerous gate. Okay, now I will teach you the foramen ovale. Ovale means the oval chamber. Here only the male section of the castle or the male persons are allowed. No females are allowed. Even the queen or the princess are not allowed to exit through this gate. Okay, only the male, that is the oval chamber, the male chamber, the oval chamber or the male chamber. I will do it another color so that, yeah, the male, the superior. We think it like that, but not like that. Okay, so what is this M stands for? M stands for the mandibular nerve. A stands for the axillary meningeal artery. See, this is the princess, right? So the second prince, another prince exit, that is the accessory one, the small one, exit through this male artery. Okay, the small one. Okay, so that is the accessory meningeal artery, and then comes the lesser. See, everyone have their own mission. Mandibular nerve, you will learn about what all parts it supplies. Mandibular nerve, where does it supply, what all branches it have, the buccal and all, you will learn. So he have a specific territory to rule and he will go through that, and he is an assistant. He just want to learn the small one. That is why he's exiting through that along with the mandibular nerve. He's like an intern. Okay, so the lesser petrosal nerve, he also have a special mission to the parotid. He has given a small position, but he has a secret mission to the parotid. And then the small emissionary wings. Okay, now the next one is the foramen lacerum. Before that, I will show you the image. Foramen ovale, as you can see here, is the oval portion. In that video also, remember, one green foramen was shown. See, I will give you a mnemonic as well, where you guys can remember. Always remember, it is ROS, rotundum, ovale and spinosum. See, here will be the rotundum, here will be the ovale, and there will be the spinosum. Here, like this only, no? Rotundum, ovale and spinosum. Okay, then always remember rows. Okay, rows. See, you need to remember it like that. Okay, now we will move on to the foramen lacerum. Foramen lacerum, it is the blocked gate. See, it is, no one is allowed. It is always वो बंद रखता है वो, क्योंकि वो very dangerous, not dangerous, it has a tendency, if we open the gate, the enemies can escape through that, so they always keep it closed. But only the old prince, that is the main prince, who is the next king, escapes through that. Okay, the first prince, just remember it like that. Okay, he escapes through that. Okay, see, it is a tiny gate and it is closed by cartilage. It is made up of many stones. Okay, and only the nerve to pterygoid, or it is not the main nerve, but you can remember it is the first prince, something like that. So the nerve to pterygoid or the Vidian canal escapes through this lacerum. Okay, where is lacerum located? Where is the lacerum? This is the lacerum. You can remember the nasal portion, cartilage, it is blocked. Lacerum is here. Rose is this side, lacerum is this side, rose is this side. The rotundum, ovale, spinosum, and side onto that it is the lacerum, little bit upper part. Okay, so yeah. Now the last one, the grand gate, that is the foramen ovale. Sorry, the foramen magnum. The foramen ovale is over. The foramen magnum, the great grand gate. that is where the majesty escapes through, the majesty exits through. Or you can learn like magnum, you can remember it is the ice cream, the grand gate, okay, not gate, okay. So you know, the king of our body, spinal cord, which gives us support, the arteries which is concerned with that, जो भी किंग से जुड़े हुए हैं, जो भी मंत्री जो भी है, वो लोग उसमें से एक्सिट कर देते हैं. और एक्सेसरी नर्व के लिए भी एक स्पाइनल रूट है, ठीक है. मतलब ये मुझसे पूछा था, जैसे दिस वाज आस्क्ड इन माय वाइवा एग्जाम ड्यूरिंग माय एनाटॉमी last final exam. What are the contents of the magnum, foramen magnum? What is the accessory nerve and what is the branch? What are the branches of the what are the branches? Vertebral artery and all. Like it was asked actually. You will learn it later. Just remember the grand gate is the magnum, the majesty. Okay, the majesty. So yeah, last but not the least, it is the optical canal. Means optic canal. From the word itself, it is concerned. That is the royal vision canal. Only the optical components pass through that. That is the optic nerve. That is the cranial nerve number 2. Okay. Then the second one is the ophthalmic artery. Nothing else. You can remember it like that. So yeah, this is the magnum. This is the rotundum, this is the ovale, the red is the spinosum, then this pink is the lacerum. So now you guys know what is basalis, what is the inferior part of the skull, and the skull castle, the entire region is mastered. We have a blue map, that we see now that when we plan something, the blue map and all that, whatever, I don't know, the blueprint, the blueprint we say. We have that in our mind, okay, so we can go through anywhere in the skull right now. So yeah, that's it for today, and I hope you guys enjoyed the video as well. Should be relaxed as well, enjoy like a storytelling. You should learn the subject and be happy, and always be very happy and grateful to God that you are learning new knowledge day by day. And I hope you all do good and happy learning. We will see you in the next video. Till then, bye bye, take care.